Hi there, my name is Dr. Claire Corridon. I am a veterinary surgeon. I've been a vet for the last 25 years. I have a PhD in animal behaviour and welfare, and I've spent many years studying dogs in particular, but predominantly the relationship between people and animals, and understanding both the good and the bad aspects of that relationship. I counsel people that are having difficulties with their pets, with behavioural problems, cats, dogs, parrots, sometimes horses. Um, but interestingly, for this particular lecture, I'm also a foster carer. Myself and my husband have been approved for the last 4 years, and we've so far fostered 4 children. So it's interesting, more and more of my caseload are people either with small children or perhaps couples who are expecting their first baby, and they want to be thinking about how to introduce the baby to a household where a dog is already living, and how they can do a risk assessment of their home and their garden environment to make sure that both children and pets are safe at all times, and then also how to prepare the pets as best as you can, so that they're not in any way shocked or surprised when a child comes into the home environment. There's an awful lot of things about the daily routine that's going to change, particularly when it's a small baby that's going to be coming into the family. But if it's older children who are more active, more mobile, the contrast, this before and after for the pets is going to be much, much bigger. So there's certain things that we need to be thinking about in terms of keeping everybody safe and ideally happy, so that the situation is going to work. We can minimise the risk of problems and ensure that the children do genuinely get the benefit of living with pets, rather than some of the more negative aspects of pet care. So what I wanted to talk about predominantly today were why pets are important. Why do we get pets, and why are they perceived as being so good for us, and particularly with vulnerable people, so children, the elderly, and then certain people that have experienced particular trauma or difficulties in their lives. We're going to look at which aspects of care might benefit from the presence of a pet. So pets have been used for quite a long time now in a therapeutic role to encourage and in some cases facilitate treatment for particular types of people. And then animal assisted therapy. So we know that there's lots and lots of positives for people in having controlled interactions with animals. So it's just thinking about the welfare of the animals as well, to make sure that everybody's getting a benefit from the situation, and that in no way is welfare being compromised, either in the part of the patient or the animals themselves. And then what if we are going to have difficulties, what sort of challenges might people expect to see, and what can be done to minimise those risks so that everybody's benefiting from a positive human animal bond. So I've spent probably the last 25 years now looking at the human animal bond. So part of that was working as a vet in first opinion practice, dealing with people when they're embarking on a new relationship with a new pet, whether it's a cat, a dog, a rat, a hamster, a rainbow parrot. It could be any type of pet. But then also looking at when things start to go wrong. So there could be an emergency situation where there's been an accident, an injury, or a very, very sick pet whose welfare has been seriously compromised, and we have the emotional turmoil that then accompanies that for their owners as well. And obviously, at the extreme end of that relationship, as part of my job, we have to do quality of life assessments when animals are really struggling. And as veterinary surgeons, we have a role, and in some cases a moral obligation, to be euthanizing animals where their welfare is seriously compromised, and where it's in the best interest of the animal themselves, as well as their owners. So when you're studying the human animal bond, it's interesting to see kind of where it's come from. So initially people eh, became companions with animals for a very functional purpose. So having animals in a community or with a group of people helped to provide security. They would hunt together, and it was mutually beneficial. So if they're more successful with hunting, there was more food to go around, and if they were able to protect the family, the territory, and the sort of living space, everybody benefited from that. So animals, particularly dogs, have spent a very long time learning to live in communities of people, and specifically within a family unit, so that they increase the success of that relationship and minimize the risks. And with any relationship, we have to be looking at the pros and cons of it, which is where the sort of exchange and equity theory side of it comes in. So if you go into a relationship with an animal with particular expectations and they are not met for whatever reason, and the relationship falls short, that is then going to put that bond at risk. So those are the animals that are either going to be rehomed, returned to the source, whether it's been a breeder or a charity, and in some cases, depending on the severity of the issues, those animals may be at risk of being put to sleep as well. Social support is a huge part, and the majority of people, when you ask them what was your primary reason for getting a dog, it's been companionship. So shared experience, shared life, shared routines, and just that feeling of never being on your own, having somebody there to greet you, hopefully who's pleased to see you when you get home at night, and just spending positive time together. Um, and as part of that, when you spend time together, when you get to rely on each other, that then becomes an affectional bond. So pets have a role as confidants. You can tell them anything and they're not going to pass on your secrets because they're not able to communicate to anybody else what you've told them in secret. They're there for you, whether you're happy, you're sad, if you're feeling unwell, if you're grieving. They generally enjoy spending time close to you and enjoy fuss and attention. And even if it's just snuggling up on the couch together in front of a film, they enjoy that close contact and that positive relationship. And for us, that then becomes quite a powerful affectional bond. And I'm constantly meeting people who tell me that they love their pet, whether it's a cat, a dog, a horse, whatever it is that they're attached to, more than some of their family members, and sometimes better than any of their family members. But that's probably a human situation as opposed to related to the animals themselves. And self-object theory is particularly interesting, where people are vulnerable, where their social support in terms of their human interactions, so with perhaps partners or family members or friends, where their social support with people is limited, their relationship with their pet can actually take on a different dimension, and they can in some cases become a little bit overly dependent on the animal. And there's pros and cons for that, for both the person and for the animal themselves. But it's an interesting psychology subject. If this is an area that you're interested in, do go and look it up. And I've included references for each of these human animal bond theories here so that you can look at it at your leisure. So I thought it'd be interesting for the next few slides to look at these different aspects of the human-animal bond and look at some examples of how pets can actually be not only important but hugely beneficial when they're living with people in general, and then people from particular backgrounds or that are experiencing particular challenges. Emotional benefits. So, as I said to you, I regularly meet people who tell me they feel closer to their pets than they do their family members. And pets can show great loyalty to their owners as well. So they're there, they're reliable, irrespective of what's going on in life. And they can provide humour and entertainment as part of their behaviours, particularly where you see animals with a new toy or animals interacting with each other in some cases. Particularly, I'm imagining new kitten owners where they're running and chasing each other, and they're far more entertaining than watching TV in some cases. Animals are non-judgmental, so irrespective of what you've done or said or how you're feeling, your animal will be there for you in a non-judgmental way, and they provide unconditional love. So long as they're getting what they need from life, their access to food and water, access to opportunities to go to the toilet, and ideally opportunities for pleasure and play and all the positive things in life as well. So long as they're getting their needs met, they will give the person providing that to them with unconditional love. And they adapt to their owner's life and personality. I say dogs and people have lived together for thousands of years, and dogs are phenomenal at reading people. They know our moods, they know our patterns and our routines and what we're going to be doing based on what we're wearing or what we've got in our hands at a particular time. So they're great at reading us, and they know when we're happy or sad, when we're about to head outside, where we're going to be, if we're busy, engrossed in watching the TV or reading a book or cooking or doing those kind of things. They read what we're doing, and they will adjust their behaviours accordingly. Mental benefits. So older people may well rely on the company and a reason to get up in the morning. And those experiencing illness, physical or psychological challenges may really benefit from those emotional aspects of the relationship that I just talked about in terms of non-judgmental, unconditional love. People experiencing grief or PTSD, we know that having a pet living in close proximity or as part of the therapeutic process, that could be regular visits, or the presence of a pet during a therapeutic session, can actually really help with the person engaging in treatment and helping to reduce those stresses, and to be able to trust the person facilitating the treatment, and also get the most benefit out of the session as well. So for children, this is particularly important because pets are often described by children as their friend. They're very much part of the family, and you'll see pictures that kids have been asked to produce of their family, and their pet is very much a feature of the picture. And in some cases, they're bigger than some members of the family, just in terms of the size of the size of the drawing. Irrespective of it, could be a cat, and they're not necessarily to scale. If the cat's got a big part to play in the child's life, you'll find that they tend to be slightly out of proportion in terms of their representation in a drawing of the family. They share experiences, so they're sharing birthdays and Christmas, they're sharing, might be weekend trips to the beach or to the woods, or lots of positive things like that. And they definitely help to teach empathy, respect and responsibility. So I know for me, getting my first cat, getting my first dog, them being introduced into the family, understanding what they needed in terms of learning and care, taking them to the vet when they needed that, and then ultimately, when we lose them, when they start to become unwell, when if they die or if they have to be helped along and put to sleep, sometimes for a lot of children that's their first experience of death, particularly to an individual who's part of the family, or with whom they have a close relationship. And understanding about the circle of life and death. Death and illness is really important, and it helps to teach children and to learn their own coping mechanisms for dealing with these situations as well. Our social benefits, so social catalysts. So there's been studies looking at a person dressed in a particular way, holding a plant, holding an inanimate object like a teddy bear, and then holding a dog. And people are much more likely to engage with a person if they are accompanied by a pet, particularly a dog. And obviously the type of dog can make a difference as well. So a friendly tail wagging dog, a dog wearing a bandana, or presented in a particular way that makes them look soft and gentle and approachable means that people are much more likely to approach the person who is accompanying that particular dog as well. There are social benefits, so it encourages interactions out on walks. It might encourage you to go to a class, or it might be a training session. It gives you something to talk about. I don't know, if you're out in the pub or in the supermarket, you could be comparing pet foods in the supermarket aisle, and somebody else is looking at a similar thing. It's a social catalyst. It encourages people to talk to each other because they've got this one thing they know they have in common, which is the pet, or the interest in the pet. They can help reduce feelings of loneliness, and they can compensate for the absence of close human contact. And I'm not saying that they're, that it's a desirable alternative to close human relationships, but where those relationships have been damaged or lessened in some way, knowing that they've got the reliance, the confidence, and the loyalty from a pet can help to reduce the impact of those negative or slightly tenuous close human relationships as well. And the level of attachment becomes really important, whether it's positive or negative. So where the relationship has been challenged and there's difficulties, the attachment to the pet is going to be damaged as a result of that, and that's going to have consequences, particularly for the animal in the longer term. But where the relationship is positive and the child is particularly attached to their pet, irrespective of the type of pet it could be a hamster, rats, chinchillas, cats, dogs, rabbits, it could be any kind of pet at all. If the child is incredibly attached to that individual animal, it's really important that any plans for that child in terms of where they're living and who they're living with, and whether they're going to be able to live beside the pet that they're incredibly attached to, or whether there's going to have to be some sort of access or visitation with that pet, that all needs to be considered where we're looking at the overall well-being of the child as well. Physical benefit. So I've talked a little bit about these positive physiological effects. So not only is it helping to make us feel calm and settled, it can help to increase serotonin, which is our happy hormone, and it can also help to increase oxytocin and prolactin. So oxytocin is particularly associated with positive, close relationships. Prolactin is interesting because it's involved in milk release, particularly in a relationship between a mother, irrespective of species, and their young. And it's interesting, so that effect we see in humans, we don't actually see a reciprocal effect in animals for that one. But everything else is, the animals are actually getting the same benefits as we are in terms of reducing stress levels. So just be mindful. I spend a lot of my time talking to people that have got behavioural problems or challenges with their pets. So where the animal is stressed, anxious, fearful about a particular situation, that's equally going to have a reciprocal effect on their owner, depending on the owner's experience, depending on the owner's perception of that problem. So where one individual is upset, aroused, perhaps becoming, in some cases, aggressive as a result of that, that can have a huge stress impact on their owner as well. In some countries, the physical benefits of living with pets are so well recognised that they're actually prescribed. So I'm thinking particularly about people in Germany who have heart conditions. So they're actually being actively encouraged to go out and get a pet to help improve their cardiac health. And then therapeutic benefits. So we've used animals, and particularly dogs, in a therapeutic role for many, many years now. And I'm sure you're all familiar with the guide dogs for people with impaired sight. Dogs can also be trained as disability assistance animals, so doing various things. It could be answering the telephone at the door, it could be loading the washing machine, it could be physically helping to right people that have fallen or that are using a wheelchair, walking stick, Zimmer frame, all those kind of things. And dogs can be trained to help support people with various different types of disabilities. Autism is an interesting one. So just in terms of the behavioural responses to autism, sometimes having an animal who is calm and able to cope in particularly high stress or potentially high stress situations can really help a child or a person who is um, having the effects of autism. And but again, I'd be really mindful of the reciprocity of that effect. So where there are raised voices and sometimes unpredictable behaviours in a person, an animal who is in close proximity to that person has got the potential to become stressed as a result of it too. So if they are if they've been selected because they are a particular breed or temperament where they are calm and they're really, really stoic, irrespective of what's going on around them, they've got the potential to have a hugely powerful emotional supportive effect on somebody who's experiencing the effects of stress. If the individual is not of the right temperament, whether it's a dog or a cat or a horse in it, or any other species of animal we were using in a therapeutic role, we have to be really mindful of the fact that the animal could be experiencing stress in those situations as well. And they're most definitely a catalyst for counselling. So where a therapist, counsellor, psychiatrist, psychologist is actually studying or working with an individual, having a calm, relaxed pet in that environment can actually help not only engage the patient but actually ensure that they get the best out of those therapy sessions as well. The challenges to pet ownership. So, unfortunately, at the moment, I'm spending a lot of time helping counsel people that are having challenges with their pets. So, sometimes it is to do with the behaviour of the animal, and this all comes back to expectation. It depends why people have chosen to get a pet in the first place and what the role of that pet was going to be. So if it was a person who had a child who was suffering with either autism, ADHD, and the animal has not got the right temperament for that, and they're actually exacerbating stressful situations instead of alleviating them, that's going to be a real problem because the pet is not fulfilling the owner's expectation. The timing restriction, so having a pet, irrespective of what species they are, requires a time input. That might be in cleaning out their environment, it could be ensuring that they get the appropriate exercise and play, making sure that they get food and water, and the time that it takes to get all that organised. So acquiring it, preparing it, physically giving it, and then cleaning up after it as well. And then housing requirements, depending on where people live, and this can be a big challenge where people are in rented accommodation. There could be issues with either the size, the space, the rules, landlords, all those kind of things in terms of housing, and then conflict within the household. So as part of my behaviour cases, I always ask people, and I ask each individual member of the family to give me a rating for the pet within the household. So where you have somebody who rates their pet as a 9 out of 10 on a bonding scale, living with somebody where the pet is a real pain and they perceive them as being a 2 out of 10, that can be hugely challenging. It's going to be a source of conflict and sometimes heated discussion in my absence, and a lot sometimes in my presence as well. But where there's conflict, where there's different ideas about what's acceptable and what's not acceptable. Maybe one individual within the family is very much the advocate for the pet and excusing all their behaviours, whereas the others are having to cope with things and are perhaps feeling less positive about it. Conflict is something else to be mindful of, and then medical challenges as well. So wherever there's if there's illness, disease, if there's chronic pain going on, if there's age-related conditions going on, it's going to have a direct impact on the behaviour of the pet, and then it's going to have an impact on the human-animal bond as well. Whether it's positive or negative, and these things can go either way depending on the circumstances and the individuals within the dyad, between the human-animal dyad. I wanted to put this in because I think, particularly in terms of the cases that come into foster care, depending on the background and what's going on at home, this is just something else to be mindful of. So where there is any sort of neglect, physical abuse, sexual abuse, or mental abuse going on in a household. And when I say mental abuse, in terms of pets, that could be raised voices, it could be intimidating behaviours, anything at all like that. And I think the other types of abuse I've described there are fairly self-explanatory. This is an area that is very well documented now, and it's something that every veterinary surgeon and ideally every pet owner should be mindful of, that in a family where there's abuse going on, there could be more than one victim. So where there are difficulties documented in terms of the people living in a household, we need to be mindful of the fact that the pets could be involved in that as well. And the opposite is true as well. So sometimes in veterinary practice we see things that basically raise a flag, and either the description of the incident or whatever's happened to the animal doesn't fit with what we can see clinically. Sometimes it's a particular type of injury that we know has been deliberate. It's not something that could have happened by accident. So if we see something like that in a veterinary patient, we need to be making sure that we're reporting that to the appropriate authorities to make sure that if there's anything else going on at home, that the flags are raised. And ideally, if something's been picked up in a school by a doctor in a A&E department, and also the vet has raised the flag as well, then the appropriate investigation is going to. When we're thinking about children in foster care, it's really important that we consider the home environment that they've come from, as well as the home environment they're going to hopefully be going into in terms of a foster care placement. So if they've been particularly attached to a family pet in their home environment and they're going to be moved for whatever reason, if that relationship has been really important to the child, it's really important that that is considered when you're coming up with a care plan for that individual child. So that might be it could be inquiring with the new foster family if it's feasible for the pet to go with them. It could be organising regular visits so that they don't completely lose that relationship and the associated attachment that could be really damaging to a child where the pet's had a big part to play in their life. And if they're coming into a new foster home, it's really important that we know the background of the child. Are they used to pets? Have they lived with animals before? Have they had a fearful experience? Are they frightened of cats or dogs or rabbits for whatever reason? Is this actually going to be really difficult for the child to become accustomed to living in a house where animals are present too? And depending on how the new foster family lives with those pets. So in some households in Ireland, dogs are living outside, rabbits are living outside in hutches, and there is potential to keep pet and child apart, but it's becoming much more common for cats, dogs, and rabbits to be living inside the family home, and so it's really important that the child's not going to be fearful of that animal. It's going to be really difficult for them to live in a house with an animal they're frightened of. Hopefully, if they've had limited experience with pets before, hopefully they've not actually had damaging experience. If it's neutral or absent experience that they're building from, it just takes a little bit more time and thought and planning to help them become accustomed to living with a pet. And there could be lots of positive ways of doing that by getting them involved in the care of the pet. And we talked about the benefits in terms of understanding empathy and the care that's involved in looking after another individual. And that could be really beneficial for children. But if they've left a pet that they really love, and they're having to adjust to a new environment, new foster carers, and then the absence of the birth family as well, if the pet has had a big part to play in their life, it's really important that we try and facilitate contact with that pet so that those ties are not completely cut. And then in terms of facilitating therapy, pets are just phenomenal at this. So long as the child is not fearful of the pet, whether it's a cat, a dog, a rabbit, time spent with horses as well, it can be really powerful. Children are much more likely to trust a person who's kind, who they see being kind to an animal, and it's going to have they're going to be more trusting of that individual and hopefully get more benefit out of the therapeutic relationship as a result of that as well. Many of the children who come into care can be distrustful and struggle at first to form positive attachments with the adults who care for them due to past trauma. Through no fault of their own, they may have had many moves in a short space of time from different foster families and so feel anxious about a new home. This is where a pet can bring a sense of calm and provide a great source of companionship to a young person in care. So this is a quote from the Foster Care Association in the UK, and I think it's really powerful in understanding, particularly where there has been instability in a child's life. Sometimes just having an individual who is open to hugs, who is always pleased to see you when you come home, who you're able to basically tell anything at all without any sort of judgment, and know that your secrets are going to be safe, can be really, really powerful for children. So where the animal is of the right temperament and the relationship has got the potential to be a really good one, we need to make sure that we nourish that and encourage that. Where the animal or the background of the child, it actually means that positive relationship is going to be really challenging. It could be that the child is frightened of pets. They maybe had a bad experience with dogs before. They could be just really frightened of cats because they're small. Sometimes they can be unpredictable. They can jump around. They can do things that could startle somebody who's not acclimatized to cats. Um, where the pet is of a nervous disposition, so if they're wary of strangers, if they are really, really slow to trust, then that could actually be more challenging. In terms of empathy, that might actually be a good thing. You just don't know, and it's really important that we consider every relationship as individual. I'll talk about human animal bond dyads, so the two individuals that are involved, and in a family unit there's going to be a number of different relationships there. So we need to look at each relationship as an individual, and think about where is each coming from, in terms of past experience, temperament, and then their current state of mind, and then what is the potential for this in the short term and then longer term future, and decide whether it's potentially positive or potentially negative, in which case we need to decide if it's feasible at all, and if it's something we need to work at because we know in the longer term it is going to be a good thing, then we need to be putting a plan in place to make sure we facilitate that relationship getting stronger and not actually be damaging to the child or to the pet. Depending on the type of fostering that you want to do and who you're actually doing it through, there could be a pet questionnaire as part of the actual assessment and approval process, and that might involve getting some sort of letter or recommendation from your vet, depending on the type of pet, particularly if it's bigger dogs or any of the dogs on the restricted breed list in Ireland. That might actually involve a behavioural assessment as well. And it's worth mentioning here that doing a temperament or behaviour assessment on an animal tells us about their behaviour during that assessment period. Animals can be unpredictable. Animals who are frightened, depending on the situation that they're put in, can behave unpredictably. And particularly if they're feeling unwell, if they are in pain, if they are particularly frightened by a situation, they can behave out of character as a result of that. So it's really important, irrespective of the type of pet or their history or their perceived temperament or behavioural assessment, it's really important that we do risk assessment for any pets living with children, particularly children who are not familiar with those animals. If we mitigate for risk, we know that we've covered our bases. Accidents can still happen, we need to be mindful of that, but if we've taken every precaution, that should give some reassurance to those that are undergoing the assessment process and authorising you to foster, but then also to the birth families and the children that are being placed in your care as well. It might be a really good idea to look at matching. So if a child has had a bad experience with a particular type of pet, it may well be that and you live with that pet. It may be that your household isn't the best place for them. Equally, if children have got allergies, if they've got health problems, and if they've had emotional or mental trauma associated with pets in the past, it's definitely something to be mindful of in terms of matching. So I work with people who have challenging relationships with their pets on a regular basis. So the majority of cases that will come to me, there's behavioural challenges, whether it's fearful behaviour, separation anxiety, hyperactivity, and in some cases aggression. So where there's animals, they can experience pain, illness, trauma that has a direct impact on their behaviour just exactly the same way as people can. So we need to be mindful of that. If we know that the animals living in the household have got behavioural challenges, we need to decide just how severe a risk that's going to be, and if it's possible at all for us to mitigate that risk. The time commitment is really important. So depending on the type of pet, the time involved in caring for them is something definitely to be factoring in terms of a daily and a weekly basis. And that's not necessarily all negative. So they do need to be exercised, they do need to be cleaned out, they do need to be taken to the vet, they do need all those things done. But actually, being part of that care might actually be positive for a child. So we need to look at the actual time involved and whether this is going to be positive or negative for the children. So if a pet is particularly ill and time consuming in terms of care, is it fair then to be expecting the foster carer to be dealing with children with particularly challenging behaviours or time consuming needs, as well as a pet who has that as well? So we have to look at the whole picture, the home environment, how they're living, what challenges they've got, and then the individuals, so the foster carers, and then the potential child or children that are coming into that environment. Health challenges are really important, and I see a number of cases where either people are looking to rehome an animal because they say the doctors told them to do it because the child has asthma or eczema or other health challenges. Unfortunately, I see people who are perhaps older people who have very friable skin and are living with a cat or a dog, a puppy in particular, who like to jump up, who don't have great bite inhibition and can actually be causing both bruising and lesions on skin because they don't know any better. And it's not necessarily a compatible relationship, or it's something that needs to be managed in the shorter term, accepting that the animal's going to calm down, they're going to mature, and they're going to stop doing the kind of juvenile puppy behaviours, and things will settle down. But we just need to mitigate that risk in the shorter term. And then contact is really important. So if the pet has been a big part of the birth family, and we need to think about whether it's feasible for the child to be having ongoing contact with the pet, and that could be hugely positive. It keeps that relationship going. It might actually help to reduce some of the stresses with the birth family as well. If the pet's there, it can help facilitate, give them something to be talking about in terms of what the pet's doing or how they've been doing, and just catching up on news and that kind of thing as well. So being mindful of whether contact should include the pets or not is just one more thing to be thinking about. The Blue Dog Project has actually been around for quite a long time now, and it was very much a collaborative project, bringing together human medics, veterinary behaviourists, child psychologists, and then artists who designed a blue dog. And no child is ever going to meet a blue dog out in the street. So however the blue dog behaves in the Blue Dog Project resources, we don't have to worry about children extrapolating that to dogs out and about. So the blue dog has got various different resources. They could have their food bowl, they could have their favourite toy, they might be feeling unwell or be sleeping, and the child has to pick the appropriate response to the dog when they have something high value of their own, or if they're unwell or sleeping. And basically the child is asked to pick the appropriate response, and they'll either get a green tick or a red cross depending on whether they get it right or wrong. And there's all sorts of resources now. If you go into the blue dog world, there are learning resources for schools or clubs or families. It was designed originally for kids 3 to 7, but I think there's lots of things you can extrapolate there for either younger or older children as well. And it's just worth I think it's really powerful in terms of understanding how animals behave and why they do the things that they do, but there's lots of things that you can extrapolate to people as well. So this idea of fight, flight or freeze, people respond to stress in just the same way depending on their previous experience and their own personality and temperament. So understanding why animals do the things that they do can really help in terms of having empathy for people who are experiencing stress as well. So it's learning globally, and then preventing problems. So I think that pre-acquisition advice is really important. So it may be, and that could be a hugely positive thing if a foster family go out and actually acquire a new pet with the children in their care, so that they're involved from day one. They're involved in picking the pet, they're involved in going to pick them up, they're involved in helping that pet to settle in. There's so many different aspects of that that can really help in terms of empathy and understanding from a child's perspective as well. It's really important that we get the right pet for the right home environment. It's so much harder where the family have become bonded to an animal and they really weren't suitable. It's so much harder to try and undo that, or try and then reduce the associated risks for the family and for the pet as well. It's really important that everybody in the household is on the same page, that they're all just as keen, that everybody's involved in the decision making, and ideally in terms of that early settling in, and that there's a team effort. It could be coming up with a schedule for who's going to do what job in association with the pet, and that there's rewards and benefits where everybody's playing their part, or fulfilling their role as part of the pet's family as well. And that all those are really positive things that could be on a sticker chart or something really hugely positive for a child to work towards. And it's win-win. It's really important that we think about the fact that this could potentially be an additional loss for a child who's leaving a pet in their birth family home. It might help them to acclimatise to a new home. If there's pets there, it may be that they relate to the pets much sooner and quicker and more easily than they do their new foster carers. And in some cases, those pets might actually have a therapeutic role for children. And don't necessarily write off the dog who has challenges. So if the dog or a cat is frightened of a particular thing, and the child could actually get involved in helping work through that for the pet, and it might actually help them in terms of their own development and managing their own stress as well, because they feel like they're helping this individual who's really important to them, but they're learning all of the time. So there is potential for this to be a hugely win-win process for everybody involved, but there is always, where you have animals and children and life and all the unpredictability that's associated with that, there's always going to be risk. But so long as we plan ahead for that, there's lots of things that we can do to keep everybody safe. I've said to you before that it's really important we look at each human-animal relationship as a unique individual case, but I wanted to give you at least some guidance as to the basics in terms of first aid and mitigating for risk. So I think planning and getting your background is really important. So knowing what the routine is for the family and then for the children and the pets is really going to be important. If the child has had a history of issues with a particular either type of animal or a bad experience before, it's really important that the work is done in terms of explaining why pets react the way that they do sometimes, and what the best and safest way for the child then to respond is going to be to try and minimise the stress for everybody. Um, where there are difficulties, it's really important you get help right away and make sure it's the appropriate help as well. So much as friends and family and pet shops they've probably got all sorts of different opinions, they're not necessarily going to be consistent, and not always necessarily going to be helpful either. So it's worth speaking to your veterinary practice, and then finding out if there's people locally who they would then trust and recommend for you to be talking to about behavioural support for the pets. And in that case, it's really important that that person understands the individual and unique challenges within that household. At the moment, I like to do all of my behaviour cases at home. I like to see both the owners and the pets in their own environment, so that I can really make practical suggestions as to what's going to work for those individuals. And seeing an animal in their home environment, I really get to see their behaviour as it actually is. In a clinic environment, it either masks what's going on because they don't feel safe, or particularly in a fearful animal, it might actually just make them 100 times worse than they would be normally. So speak to your veterinary practice and make sure that you're getting the right advice and the recommendations for the right people to help you. And then if there's challenges, if there's problems, and if there's risk that is of genuine concern, and that could be emotional and mental upset just as much as physical risk, it's really important that you set realistic deadlines for things getting better, because for any person living with an animal they're either frightened of or that they're fearful for, because sometimes an animal that's incredibly fearful, it's really stressful to be around, and if it's having a negative impact on a child, that it's just, there's only so long you can let that go on for. So it's really important you set realistic deadlines for things getting better, and if it's not getting better, that you've got a plan. And unfortunately, that might involve limiting the contact between the pet and the child. It might mean moving the animal. Unfortunately, it might mean moving the child as well. So, these are huge decisions, and it's really important that the homework and the bases have been covered before those decisions are made. I wanted to give you some practical solutions as well. I have two small children under 4 living with 2 dogs at the moment. We've been up to 4 dogs and 2 cats previously. So children living with animals is something that we are very mindful of in our own home environment. Baby gates, closed doors, use of playpens are fabulous. So having the knowledge that you can either shut a gate or shut a door or shut a playpen door, and know that either with small children that they are safe from the animals irrespective of what happens. The doorbell could go, the phone could go, and the adult in the environment could be distracted or taken away for a period of time, irrespective of the type of pet, their temperament, your trust in them. A pet should never ever be left unsupervised with a baby or a small child. Things happen, accidents happen, animals get startled, and they behave. They react depending on their experience and their individual temperament. But if they're frightened, they can scrabble to get away. They could redirect either fearful behaviour or, in some cases, aggressive behaviour as well. So no matter who the pet is or how much you love or trust them, we just never ever take the risk. If you have to leave the room, make sure that baby and dogs, cats, whoever else are contained and they're separate to the child, so that you know that absolutely nothing bad is going to happen. It's really, really important. As the children get older, the baby gate, the closed door, and the playpen might actually be protecting the pet from the child. And I think that's really important, and it's something that, unless you're an animal person, you don't always necessarily get. But toddlers, small children, even if 95% of the time they're really good around the animals, sometimes they use too much pressure, sometimes they just don't realise either they're touching an area that is sensitive on the animal or they're actually hurting them with the pressure that they're using. Children can do some really horrendous things to animals, and the most stoic, gentle, trustworthy animal, if they're really frightened or in pain, they can react, and it's just not worth risking it, not for the pet and not for the child. It's just not worth it. So making sure that you've got barriers, you've got child friendly areas, pet friendly areas is really, really important. So for dogs, any dog living in a household with children has to have a den. So that could be a covered crate, it could be an area behind the couch or under the stairs. They need an area that they can go to at any time of day or night to get away from people and get away from children. And your children have to be trained that if the dog is in the den, they are left alone. If the rabbit is in their bed in their hut and they want to be left alone, they will be left there. They will not be dragged out. Nobody's going to stick a hand in or try and move them. A fearful animal who has retreated to their den does not want to be dragged out or does not want to be threatened in any way, and they will react accordingly. And again, it's just not worth risking it. So we have to, we can do the very best we can to train the animals to be safe around the kids, but we have to train the children as, you know, as appropriate for their age and their stage of development. We have to train children to be safe around pets as well. For cats, we can use height. So yeah, if you go online and look at environmental enrichment for cats, there's amazing things that you can do. So it could be cat trees that you purchase. It could be a bit DIY at home and looking at cat shelves and lying areas. Cats are great at hiding under the bed or going on top of the wardrobe naturally to get away from situations they're unsure of. But there's lots of things we could do to make it even better for them. And get children involved in designing that and help you actually make those things. You know, they're going to have a huge sense of pride. They're going to feel involved. They're going to have empathy for the fact that the cat needs to be able to get away sometimes. The cat likes to sit up there and they can see everything that's going on and they know they're safe up there. Nobody can get to them. And again, just in terms of empathy, that's really powerful for children as well. And then if you've got time in terms of the planning, we can desensitize pets to the noises that we associate with different ages of kids. So if it's a new baby, we can get them used to crying and laughing and gurgling, and the fact that when the owner or the caregiver is in the room, they're not necessarily 110% available to the pet. They might be feeding or changing or entertaining the baby. So the dog needs to become accustomed to that and not think that my caregiver's in the room, therefore I get attention and affection and whatever I need, because that can be a real adjustment in a household where the dog has been the baby until the arrival of the genuine article, and the real baby could actually be a bit of a shock to the system for a dog who has not been given the appropriate preparation. And if it's going to be older kids that they're going to be getting having to adjust to living with, we can get them used to, within reason and with, you know, within safety parameters, getting them used to the noisy kids in the park or close to school, and just where they're in close proximity but they're not at any risk at any time. And if the dog owner or the potential dog owner has got friends or family or neighbours with children who are well socialised with dogs, it may well be that you can enlist the help and support of your friends and family to help that dog just get practice at being safe around children, giving the appropriate signals when they're unsure, and then for the dog owner then to be able to respond accordingly and either get them to safety or distract them or do something positive to turn what could potentially be a scary situation into a positive for the dog, so that when the foster child arrives, they're already they're accustomed to it and they've got coping strategies when things are a little bit, you know, either unsure or a little bit scary for them, that they know what they can do to protect themselves basically and have their own coping mechanism. When I wrote this lecture originally, it was for a live training session. So I've said on here, if you have got questions or you have got a situation coming up and you just don't know where to start, hopefully I've given you some tips to get you started. But if you've got anything that you would like to ask me, do feel free to email me at greatexpectationsvet@gmail.com. Thank you so much for taking the time to listen to this lecture. I wanted to finish by giving you some additional resources to look to. So the Society for Companion Animal Studies have spent many years now very much promoting, studying and understanding the relationship, the positive relationship between humans and animals, and particularly where they have where the animals are in a therapeutic role, or where the people that are involved have got additional challenges. So I think you'll find some really useful resources and research articles on there as well. IHI is an international organisation which very much encourages collaboration across all the different professional disciplines, so social science, human medicine, veterinary medicine and animal behaviour, to look at how we promote healthy human-animal relationships, how we understand the therapeutic role that animals can have, and then basically how we ensure that the welfare, the physical, social and emotional needs of both individuals within the dyad are being met. So you should find some really useful resources on there too. And just lastly, I wanted to mention pet bereavement services. Now, it's not something that we have huge resources available on in Ireland at the moment, but if you look at the UK and elsewhere, you'll find there are some websites where you can find either nice poems or it could be comforting pictures. You can leave messages, so you can leave a dedication to an animal that you've lost. And I think particularly for children, it's really powerful to either draw a picture or write a story about a pet that they love. And it's all part of that grieving process and really important. And I think unless you're a pet owner, particularly if you've lost a pet as a child, unless you've been through that, other people don't necessarily understand just how difficult this can be. And for a lot of children, it is their very first experience of death and bereavement. So it's really important that if we can support them and help them through that, that we do. Okay, thank you again.